This week on Act Out, healthcare, sickcare, the GOP, the ACA, and the real solution that neither side of the corporatocracy wants to talk about. Next, we take you into the streets for the Native Nations Rise actions from this past week. And finally, Tangerine Bolen sits down with us to discuss her latest case against Trump. For people, for planet, for water is life. From tweets to marching in the streets, this is Act Out. Welcome to Act Out. I'm Eleanor Goldfield, and this is your tipping point. So you may have heard the phrase, healthcare is a human right. You may have also heard that neither of the two parties in our oligarchical duopoly think that that is a thing. The Affordable Care Act is neither affordable nor caring, as we covered in episode 84 with activist and doctor Margaret Flowers. Does that mean that people haven't benefited from some aspects of the ACA? Absolutely not. People with pre-existing conditions, for example, big pharma for another. Think of it this way. It's as if the government has an entire loaf of bread to give out and gives the starving guy a small little corner, and gives the glutton the entire loaf minus that little piece. The glutton then charges the starving guy for the piece that he got from the government, and charges the government for giving him almost the entire loaf. Now, to be fair, the glutton did shove some money into the pockets of government officials to get more of the bread. According to Open Secret's 1,257 unique organizations lobbied for a bigger slice of the ACA loaf, so to speak. Funny how the list is all big pharma and insurance companies, huh? Multi-million-dollar businesses. The sick and poor cannot compete with that, and we don't. The ACA was structured to give us just enough to shut the fuck up while awarding the already grossly rich with more money. Fast forward to today, and we're still paying more for prescription drugs in this country than anywhere else in the world. These are just a few examples. And that includes places with socialized healthcare. But socialism... We're also paying more for routine medical procedures, not to mention in-depth or life-saving procedures. Want to beat cancer? Well, I hope that you have a house lying around that you're looking to walk away from. In short, that glutton, the pharmaceutical and health insurance industries, they are the big winners in Obamacare, not us. Forcing Americans to buy private insurance plans will obviously benefit the corporations that offer those plans. Striking a deal with Big Pharma dictating that government cannot control prescription med costs will obviously benefit the seller, not the buyer. Now, I'm not here to only shit on the ACA. After all, as I mentioned, I've already done that with the help of Dr. Margaret Flowers in episode 84. What I am here to do is talk about the alternatives. As of now, there are two. One is the GOP alternative to the ACA, which came out last week and is, it's what you'd expect and then some. In short, it doesn't so much repeal the ACA, more just make it shittier. Here are a few of the bullet points. Standard & Poor estimates that 6 to 10 million more people would lose health insurance under this Republican plan. 2 to 4 million would lose private insurance, and 4 to 6 million would lose Medicaid. The 400 wealthiest households in America, because of this tax cut, will see annual tax cuts of $7 million per household. The proposal includes a large tax break for insurance companies as well that pay their CEOs over $500,000 per year. It also defunds Planned Parenthood and eliminates abortion coverage. The proposal shifts the age ratio for premiums, allowing insurance companies to charge older Americans up to 5 times as much as young people. Lowers the already low standard of what qualifies as coverage so that health insurers can sell plans that cover less than 60% of covered benefits. You'll still pay a penalty for not having insurance, but this premium won't just go to the insurance companies rather than the government because they need more money. It will also include some very janky math. If in the prior year you had a gap in health insurance coverage of more than 63 days, Then, when you go back to buy health insurance, you'll pay a premium on top of your premium that will represent 30% more. So that's a lot of fucking math, right? Unnecessary. Wouldn't it be easier if everyone just got free fucking healthcare? As Dr. Margaret Flowers more eloquently put it in a recent article, quote, "Neither the Democrats' ACA nor the Republican American Health Care Act will create meaningful health security for people in the United States. We are already spending enough money on health care to provide comprehensive coverage to every person living in the U.S. without requiring premiums or out-of-pocket costs, such as copays and premiums." And this brings us to the other alternative: National Improved Medicare for All, or single-payer healthcare, or HR 676, or indeed, healthcare is a fucking human right. HR 676 closes the loopholes present in the other two options by providing simple, straightforward coverage for all, from birth to death, including all medically necessary services, from a physical to cancer treatments. This means that the currently 29 million people without health insurance would be covered. And the people who routinely file for bankruptcy due to medical needs, 80% of whom, by the way, have health insurance, they'd still be solvent. People would no longer have to worry about which doctors are in their networks because every doctor would be. And because one of every $3, roughly $350 billion, that we currently spend on healthcare goes to administrators tasked with figuring out this ridiculous web of bullshit that constitutes our sick care system, well, we'd actually save money. About $6 trillion over 10 years, that's a lot of money. And as Dr. Flowers pointed out again in episode 84, the jobs lost to this new streamlined structure would be easily rerouted to healthcare jobs that actually serve people's health, not big pharma and insurance companies. In short, HR 676 would save us money and make us healthier. And it would stop that glutton from stealing the whole fucking loaf, to circle back to that metaphor. Now, HR 676 has been introduced in the House, but as with anything else, we cannot leave it up to the asshats in Congress to act in the interest of their constituents. We have to push this. We have to push for this hard. So to learn more about the bill and healthcare for all, visit healthoverprofit.org. The site offers up a wealth of information and stats, like how Medicare for all benefits everyone, from seniors to business owners. Also, go ahead and mark your calendars for April 1st, the March for Health. Although this nationwide initiative falls short of demanding Medicare for all, it does offer up a list of demands that include protecting everyone who is already insured under the ACA and calling for improvements to the ACA as opposed to the devolution. For more info on that and to read the list of demands, go to marchforhealth.org. Moving on, last week here in D.C., Indigenous activists and their allies came together for a week-long series of actions, consisting of workshops, panels, speeches, performances, and a march on Friday, all aimed at promoting Indigenous rights and the rights of the earth and the water. Native Nations Rise, a coalition of the Standing Rock Sioux and other Indigenous grassroots leaders, put out the call to action, asking that allies from across the United States and around the world march with them on Friday. Quote, "In solidarity with the Indigenous peoples of the world whose rights protect Unchimaka, Grandmother Earth, for the future generations of all." Paulette Moore, Mohawk filmmaker and professor whose film we discussed in an interview in episode 102, was on the ground in D.C. and captured some powerful and poignant footage that we are proud to share with you now. Take a look.
We're in D.C. because the Native people have to now remind President Trump and the administration and Congress that we're still here, that the Standing Rock movement is still ready to protect land, air, and water all over the country, and that Standing Rock is everywhere. Standing Rock is in Flint. Standing Rock is in Los Angeles. Standing Rock is in Louisiana, where Native peoples have become the first climate change refugees, losing land in Louisiana. So Standing Rock is everywhere. and now we're in D.C. We are at a turning point in the sense of climate crisis. Mother Earth is severely endangered, and now the values that guide, the beliefs, the traditional ways that have guided our peoples have really gotten a hearing among a broad cross-section of people in the country, and people have begun to understand that without us, there's no hope in saving the planet. Without us and the wisdom that we have nurtured through generations about how to live in harmony with Mother Earth, without it, we can't save the planet.
I believe we need to move to a point by 2050 of having an entirely clean, renewable energy grid as a nation. And we can do that, but we can't do it if we keep clinging to the past, shoving pipelines through native lands, chasing the almighty dollar at the expense of the air and the water and the earth that our children and grandchildren are going to need in order to live themselves. So I'm here in solidarity with the native people of not only the United States, but of the earth. We need to call forward the wisdom of indigenous people, especially in these times, and figure out how to live in harmony with the other living systems of the planet, not how to extract the life out of every last drop of the earth.
We don't consider it a defeat, because we went up against the nation, and it's known that, we didn't want any of our people killed. And we know that when some of our people were arrested on the bridge and they would take them north on 1806, the government had bunkers, and they were muscled in, and they had troops in there. And we even seen their budget where they were paying for 1,400 military personnel. So they were ready to kill us, and if they had to, they were waiting for us to provoke them, but we didn't, and a lot of our people got hurt and are in jail. And so we try to make it a point that, the fight is not over, because a lot of our people are still in court and are still going to be going to have to pay fines and consistently have to be working towards what happened to us. And there's going to be other pipelines that are opening up right now, and so some of the camps have moved. There's about 6 or 7 camps nationally. We're trying to make it known to the people in the government and the administration that we're still here, and that we've been here, and that we'll be here even past this administration. We're here to try to make it known that the fight is continuing, and if we need to, we will regather somewhere else, and we will occupy different pipelines, and to make this known that what's going on is not right, and this is what we term as corporate genocide, where they're killing our people through corporations, and the way that they're overtaking us, with their mining and their drilling for oil and the fossil fuel developments that they have going on and stuff, and it's hurting all our people.
I'm a Southern Ponca from Oklahoma, and the person that the present president named as the head of the EPA is Scott Pruitt, and he's from Oklahoma. And I can tell you right now that Scott Pruitt is an idiot who is in favor and in the pocket of the extractive industry, who pays for his lifestyle and all the other lifestyles of the 1%. He's not thinking of these little ones that are gathered around here. He's not thinking of the generations to come. His record in Oklahoma is that he has sued the EPA 14 times. He is put into this position to dismantle the EPA as it stands, which is the government-to-government relationship that the indigenous people have to depend on. So we're calling on all of the workers of the EPA here to stand with their conscience, to stand with the earth, to stand with the waters, to stand with the air, the fire, the sun, the moon, and live within the natural laws as we have been taught. when Native nations rise, as we are, that we're here on your behalf as well.
For images and a brief write-up of the action from last Friday, visit my site at artkillingapathy.com and check out the blog. For more info on Paulette, check out our interview with her about her film, Spirit of Standing Rock, from 2 weeks ago at the link below. And finally today, we're going to sit down with Tangerine Bolen, Executive Director of Revolution Truth. You may remember her name from 2012 when she, along with Chris Hedges, sued the Obama administration over the indefinite detention of U.S. citizens, a provision couched within Obama's NDAA. While more recently, Bolen has been deeply involved in the Standing Rock fight against the Dakota Access Pipeline. She was in town this past weekend as part of the Native Nations Rise actions and hosted a panel on her latest case. We were lucky enough to get a chance to sit down with her and talk more in depth about her work. Take a look. So first off, let's talk about the latest case, Jumping Eagle versus Trump. As I understand it, the case is stating that the pipeline is targeting indigenous communities, ignoring both religious and environmental rights, after having been rerouted away from Bismarck, a predominantly white community, because it was thought that it had the potential to cause damage. So is that the basic gist, first of all? And then also talk about the precedent and legal grounds for this case.
Oh, sure. So there are basically three different thrusts of the claim that we just filed. And what you just mentioned is correct. It's environmental injustice and racial discrimination, a clear case of both. But I think the strongest part of our case is administrative law breaking, which doesn't sound as exciting, but it just happened. So both Trump and the Army Corps just broke the law, and we intend to hold them accountable on that. And how Trump broke the law is he does not have the right as the executive to direct an independent expert agency to reverse course, as he just did, without evidentiary basis for doing so. So we intend to stop him in his tracks because he doesn't have the right to do this. It's a total overstepping of his bounds.
So, and talk about the role that the potentials play in the case, like the potential for a pipeline to leak. And we see this a lot in poor, particularly minority communities. A corporation will just come in, destroy everything, and will not be held accountable for its own malfeasance. And then, of course, the community, being that it's poor and pushed to the side, can't afford its own health and environmental issues.
Yeah, that's a really good question or topic. There are compounded effects from these scenarios. So as you just said, these pipelines are being routed through typically more vulnerable communities, more marginalized, higher levels of poverty. In this case, they couldn't have picked a more marginalized community, Native Americans who've been assaulted for hundreds of years and who do face high levels of intergenerational trauma and poverty, et cetera.
So is there strong legal grounds for that, or is that just something that you can bring up in court to say, like, and when this happens, because statistically it will, or is that too nebulous?
It's not nebulous, actually. So we have had something over dozens and dozens of leaks in North Dakota alone from other pipelines, hundreds across the nation. Sunoco, the parent company of Energy Transfer Partners, has the greatest number of leaks of any company. So, these are not simply hypothetical scenarios based on, where we're lacking in data. We have plenty of data to show that this pipeline will leak. We're working with experts from around the world who actually build these pipelines, all of whom are categorically against this particular pipeline, Dakota Access, because of the way it has been constructed and also the route that they chose, which it's so bizarre because it is the most dangerous route they could have chosen. It's not even comparable when you look at all these the facts around each of the possible routes that could have been chosen. This is the most risky.
So talk about that's the environmental impact. What about the religious and cultural importance? How is that playing a role in the case with regards to like the sacred grounds?
So there are two answers to that question. There's the answer that comes from our plaintiffs, and there's the answer that comes out of the court system and the judge. The first part of that question is, our first answer is, our plaintiffs describe this as ecological genocide. The Cannonball River, the confluence of water sources in the Standing Rock vicinity, it's deeply sacred. It's rich in historical tradition, in spiritual and religious significance to these people. I don't think, as a Caucasian American, even though I'm close to this, I can't possibly even begin to understand the sacredness of water. Water is like a living entity to these people. You don't run an oil pipeline under this lake, and this lake has sacred stones in it. I mean, so ecological genocide for them, it's quite serious, and what's really distressing and unfortunate is translating that into the court system. So moving to the court system, I think, unfortunately, and I hate to say this, but what matters most to our plaintiffs and most to all the Standing Rock tribes is the sacredness of this water, but it doesn't play out well in court. Right. It's a different paradigm and a different language. So what we do, we're very strategic about our work. We have a great lead counsel, a great legal team, and we're looking at the rule of law and where the president and the Army Corps actually broke the law, probably where ETP not probably, where they did break the law, where they circumvented permitting processes in the most unethical and absurd manner, because this is a captured, the regulatory agencies are captured by this industry. Right. And so, one of the examples we can give is that there are weld joints. So under Lake Oahe, it's called horizontal directional drilling, HDD. There are weld joints every 40 to 80 feet. Those are structurally vulnerable. But only the federal government only requires that we inspect 10% of those weld joints before they go underground. And then after they're underground, while oil is flowing, there is literally no technology in existence to continuously monitor that pipeline. Wow. So from that perspective, from the perspective of administrative law breaking, what Trump just did with the easement, what the Army Corps did with cutting off their comment period, and the perspective of environmental risk, we absolutely can win this case. It's just, it's kind of a David and Goliath situation. I mean, we're up against a $25 billion company, and we've got to work quickly.
So talk about Jumping Eagle and how she became the lead plaintiff in this case.
Oh. Well, she's one of, they're all powerful women. This is a women-led lawsuit. I mean, it's both men and women, but Sarah Jumping Eagle is a pediatrician. She's a mother of 3 children. She lives in, Standing Rock. And she has an extensive background in public health and in the pollution of water sources. Wow. So she's really not just a lead plaintiff, but sort of a key expert witness for us as far as what she's able to testify to credibly. Right. I mean, she deals in public health issues, and as a mother, of course, she has every right to testify as a mother and a doctor to the risks to this pipeline.
So talk about where we are right now and the potentials for this, because are we looking at just a possible rerouting again, or is the goal to just absolutely kill it?
So again, I guess 2 parts to that answer. I think as forward-thinking citizens, both our tribal member plaintiffs and those of us who are their allies, backing them in this, of course we want to see this pipeline completely stopped. Right. It's absolutely absurd that in 2017, when we are facing massive anthropogenic climate change, and according to the UN and other major world bodies, a very, very challenging dystopian future unless we take significant steps to reverse what we're doing, that we even are considering using these non-renewable, very dangerous energy sources. So we, of course, at the heart of this, would like to stop this pipeline. I think we're in the midst of a sort of a paradigm shift. And again, we are a bunch of volunteers, people from around the world, but we're facing this $25 billion company, and we have massive resistance, and it's an asymmetrical power imbalance. But so the pragmatic answer is maybe it will just be rerouted. But even the rerouting of this will strengthen sovereign rights, strengthen future cases around these pipelines, so that we can obtain that outcome of actually stopping these and moving to renewable energy sources, clean energy sources.
So how does that work with because you filed it in late February, if I understand. How does that work in terms, are they allowed to continue with their work and even get oil going while this case is being decided?
They are, because we didn't file for any kind of emergency injunction. We have a very hard-nosed Boston-based litigator. He's wonderful. He's an expert in the First Amendment. He's an expert in civil liberties. But he's also just an amazing strategic thinker as far as when it comes to the rule of law. And he knows very well that a judge will not agree that irreparable harm is imminent just from the construction of the pipeline under the lake. It's the actual flow of oil, and we may unfortunately have to see a few weeks or a couple months of the oil flowing before we can feasibly file for an emergency injunction to stop that irreparable harm, because we need that time to prove with our environmental and mechanical engineers and experts that this poses the grave risk that it does, and that's what we intend to do in court.
So it's a bit like the refugee thing. You have to prove that you would get killed by your host country. So they send you back, and then you get killed, and then they'll agree that you were telling the truth.
Yes, it is somewhat like that. I mean, obviously, again, it's a convergence of very different paradigms, very different worlds, and so for our native plaintiffs, the construction under Lake Oahe, of course, it's demonstrable harm, but in the U.S. court system, we have to show that the oil will leak and the oil will poison the aquifer, the oil will poison the Cannibal River, and that's how we actually stop it.
Important to note, this is just a piece of the full interview with Tangerine Bolen. For the complete video, visit our YouTube page at youtube.com/Occupy.com. And for more information on Tangerine Bolen and her work, visit revolutiontruth.org. And that'll do it for this week's Dose of Dissent. Thank you so much for watching. Please spread and share this with all of your friends, foes, and people you don't know. Check out the last slide to see all the sites mentioned in this week's show, and be sure to follow us on Twitter, Facebook, and subscribe on YouTube. From the Devil's Den, good night and act out. And real quick, to keep independent, non-corporatized media like this show going, donate at Occupy.com/donate. If you'd like to donate directly to Act Out, visit Patreon.com/ActOut.